Welcome to Living Vividly, the podcast where health, wellness, and curiosity collide. I'm Jackie, the founder of Vivid Health and Wellness, your guide on this journey to living your happiest and healthiest life. I'll be joined by some amazing co-hosts who bring their expertise and energy to every conversation. First up, we've got Daphne, our unconventional yet totally brilliant registered dietitian who's never afraid to shake up your approach to food. Then there's Dr. Mary Beth Moss, a physical therapist with a special passion for helping dancers move better and live better, no matter what stage of life they're in. And of course, we can't forget our trusty producer, Dustin, who helps keep everything running smoothly behind the scenes. We'll be having informative and engaging conversations with health and wellness pros, plus everyday people who've got incredible stories of their own health journeys. Whether you're looking to fuel your body better, move with ease, or just learn how to thrive in this crazy world, we're here to help you do it, all while living vividly. So let's dive in. Welcome back to Living Vividly. Today we are joined by someone who I consider a friend who I've recently started working together with, Dr. Ed Lafleur.
Thank you.
Thanks for being with us today.
Yeah.
Kind of has a cult following locally.
It's interesting. Interesting concept. Yep.
Can you tell us a little bit about your background, how you became a doctor? What made you?
So I'll tell you what, how it didn't happen. I don't come from a family of physicians. I don't have that lineage. I have some distant relatives. I was always interested in biology, physiology came super easy to me. Math, on the other hand, really, really upstream for me. And so when I figured out that the path to med school was mostly biology, physiology, and very little math, it was like the beginning of, okay. And I just like people, I like working with people. So, it began just as more of a science and just how the human body works. Really performed poorly the first year of college, and that may be an understatement. People say, well, you were partying. I'm like, no, I just was thinking I could show up and
adjusting. We'll just say adjusting.
Yeah, I never had to study ever. And I was convinced I was going to get through college the same way I got through everything else. And it didn't happen. And so things got real, had some difficult conversations with my dad, got a letter from the dean. It was like, you might not be able to come back here. And then I realized, okay, I have to study. Well, that led to, it takes a long time to get your GPA up after a year of doing what I did. So that led to 4 years in a row of applying to medical school. The first 2 years, I don't think they took the application seriously. I didn't even get a letter saying no. The third year I got an interview, and it was late in the cycle. And at that point, my son was 1.5 years old. He's now 29 and a fourth-year med student as we speak. I interviewed again the next year and made it. So that was LSU New Orleans for med school. I was there from 97 to 2001. There's all these things you think you're going to do or not going to do. Like med school, some people know, I'm going to be an orthopedist or a dermatologist. And I really went in thinking, well, I'm just going to let whatever tugs at me, steer me. There was some things I knew I wasn't going to be. I can't work in the dark, be a radiologist, or anesthesia didn't appeal, but family medicine was so low on my list. It was almost like I'm not doing that. I thought I was going to be a pediatrician. And then I did the pediatric surgery rotation, and I realized I love my kids. I love kids that do well and don't die. And I wouldn't say that rotation broke me, but there were a few cases that I'll never forget. And I was like, I don't think I have it in me to deal with this. And so I ended up family medicine and loved it. I love the variety. I have a pretty bad ADD brain. And so if I kept doing the same thing over and over again, that would really grow old. And so the thing about family medicine, we're trained in pediatrics, we're trained in OB, although most of us don't do OB unless you move to a really rural area. Some sports medicine, geriatrics, internal medicine, psychiatry, So
very well-rounded.
There's almost no health issue that when a patient comes in the door, we're like, nope, that's off limits. You go see that other doctor. It's like, no, you kind of have to, you don't have to, but you should handle up on it the best you can. And so it creates a lot of variety, and it keeps my brain in the game. And So I don't know if you want to hear path after that or
all of it.
All right. So, well, before I finished residency training, I was looking around for like practices that I thought I might fit well with, and had a few conversations and went and looked at what the environment was, and just none of it resonated with me. And I ended up going to Youngsville. For listeners out there who don't know Youngsville, Lafayette is a city of what, 200,000?
I think like 125.
Is it that low?
Yeah.
Really?
I've looked it up recently.
Lafayette proper,
I must
probably.
be talking about Acadiana,
maybe.
the whole region.
Maybe so.
So Youngsville was this sleepy little bedroom farming community. Almost no industry, no commerce going on there. I was fine with that. Like, kind of identify as country doctor at heart. Set up there, went solo practice like right out of the mill, and was fun. I was like, I'm going to do it my way. I'm going to spend extra time. I'm going to have results that are better than what I'm used to seeing in residency training. And
so you knew that from the beginning. I mean, you recognized that the system was not, you weren't spending enough time with patients to really understand that from the very beginning, it sounds like.
Totally. Yeah. And so to back up, I guess, a bit, the first book I ever read for the sake of reading it was Spontaneous Healing by Andrew Weil.
Okay.
And that was, I think I finished it 2 months before I started med school in August of 1997. I read tons of other books that were forced, but this one just appealed to me. I read it. And Andrew Weil, for those of you who don't know, Harvard trained medical doctor who went deep, functional, holistic. And so this book was talking about just spontaneous healing, the power of the human body to heal itself.
He's like the godfather, I think,
he's amazing.
Of functional
and
medicine.
He got into some nutrition, not a ton in that book, but it definitely planted seeds. And I was, read the book and I'm thinking, well, I can't wait to learn more about this in this next 4 years of med school. And I didn't learn anything about that. I'm like, when are we going to talk about the body's ability to really heal and whatnot? And it didn't happen. And then residency, definitely not. It didn't take me long in that first couple of years in private practice by myself to realize I just wasn't getting anyone well. Mm-hmm. That was the worst part, and I felt like it was just like I was becoming what I didn't like in other practices that I saw. It's like, it's a mill. It's like the people come in, have short conversations about what their labs look like or what their complaints are. And then the toolbox that we're equipped with as primary care is mostly pharmaceuticals, and so I was just getting really, really disillusioned really quickly, thinking like, did I go through all of this for this outcome? That went on from 2004 until 2011, when I read the next book that I read purely for the sake of reading it, and it was The Paleo Solution by Rob Wolf. Mm-hmm. I read it, and my wife Kaja read it at the same time. And personally, I read it from a skeptic point of view. Right. Like, I wanted to make darn sure that what was in this book, like it needed to sit well with me from a biochemistry, physiology, what I knew about the human body. And I was pretty sure I was going to poke holes in the book. Mm-hmm. It's like, I couldn't. And we both finished the book at the same time, my wife and I remember this well. So this was February of 2011. And the Wednesday before Mardi Gras, we were just sitting around at the table deciding like, okay, we don't have plans. We didn't have money to go skiing like everybody else. Like, what are we going to do? And I'm hoping we'll go to like the mountains somewhere, like even the Smokies or something. And I got outvoted. And so it's Disney. And
that's quite different from the mountains.
Yeah. And so we planned the trip, and it's going to be a road trip. And I decided I was going to really take it for the team. Audience, y'all, like, don't do this. But wasn't that far from doing all-nighters in medicine. I'm like, I can do an all-nighter, and we'll leave at 7:00 at night.
Ooh.
It's an 11 and a half hour or so drive. I know how to like budget caffeine and everything else.
And you had little children at this point.
Oh yeah. 4 kids in the back and my wife. And I'm like, I want y'all to be able to just like go to sleep. I got this. And y'all are going to wake up. The sun will be coming up and we'll be in Orlando and off we go. And then I said, now I know how this works from residency training. And around 6:30 or 7:00, like when I'm done, that night I'm going to be done. And I don't want to like, oh, we want to see the fireworks. Well, anyway, we decided to take this trip, and I asked my wife, Kaja, I said, all right, so we just read the Paleo Solution. We learned about wheat. We learned about corn. We learned about sugar. We learned about bad oils, corn, all this stuff. Do we want to employ this before the trip and do it, like make it happen? Or did we just let it rip at Disney, which, and then come back and do it? And she said, and I knew she would say this, like, no, we're going to do this on the trip. But not really force it on the kids.
Yeah. That's a very bold decision.
Right. Our son at that time was 16. Anna was 13. Corinne was 10. And our baby, Elise, was like 6 years old. So that wouldn't have been fun. And so we let them eat. And we just did like, now I look at it and I call it like dirty keto.
Right.
So go to the fast food burger joint. And instead of getting the burger and the fries and the bread and all that other stuff, just like, grain-fed hamburger patty with fake cheese and bad oil. But at least we'll be getting rid of wheat flour and potatoes and seed oil. On the trip, we felt better. And we came back and we haven't looked back. And so then I started like hand selecting certain patients who I thought would be receptive. And these are people on, you name it, like diabetes medications, blood pressure medication, acid reflux, whatnot. And one at a time, I'm like, all right, go get this book. And I guess I was handpicking people that I had a good relationship with and I thought would really trust me and take action on it. And the things I started seeing in their health, whether it was their blood pressure, acid reflux disappearing like within a week. These are people who've been on like a proton pump inhibitor for decades. Maybe, and still having acid reflux on the proton pump inhibitor. What happened to people's blood sugar blew my mind. HDL cholesterol, which that's the one we're taught is the good cholesterol, as if LDL is the bad cholesterol. We're taught like your HDL is kind of whatever it's going to be. Exercise, you might be able to move it a little bit.
Right. So we're talking exercise and don't smoke. Those are the 2 lifestyle things that you can do to support your HDL.
Yeah. So I never had seen an HDL move more than 5 to 7 points, like consistently. And all of a sudden, HDLs are going up 20, 30 points.
Wow.
And their A1C, so which is the 3-month average of their blood sugar, is just like normalizing. Everything was beginning to click. And then I had an acupuncture practitioner in the office at the time, who's actually the one who convinced me to read the book. I'm sending people to Barnes & Noble, back when bookstores existed, and they kept selling out. So people started buying it online. And then finally I told Adam, you should order these books in bulk. And I'll just send people to walk down the hall. And I don't even know. My guess is he probably sold 1,000 copies of the book. Not everybody read it, of course. And the ones who read it, not everyone did it. But I started to have this community and this population of patients they were getting empowered. They were seeing it. They were feeling the health benefits of it. And now I'm in the business, instead of like loading up pharmaceuticals, to like, I don't need many pharmaceuticals.
Right.
There are still some that are good. If you showed up with strep throat, I'm not really going with oregano oil and rose, like whatever. Like, if let's give some amoxicillin or whatever. Right. But the chronic health pharmaceuticals, became like a kind of a rare thing for me to prescribe a new prescription of that. And that led to financial ruin for me, because the system, the mainstream health system, is wired for, and they don't teach you this in med school, but you just learn it. It's the 7-minute office visit.
Right.
Maybe 10. If your tool is pharmaceuticals, well, you can get that done. Like, your LDL is still not quite at goal. Here's a little bit more Lipitor or Crestor. And the uninformed patient takes that prescription or the electronic, equivalent, and they go down to the pharmacy and they pick it up and they say, well, we'll just come back in 3 months. We'll recheck it. Oh, bravo, you're at goal. And they think everything's great. Well, those are quick office visits, know, and the patient that doesn't know better, well, they're happy. And I truly believe the physician or nurse practitioner who doesn't know better, we all like to see results, success, it's at goal, get the gold star. So when you start asking questions about food, movement, sleep, supplements, it's
long conversations.
There's no 7 minutes,
right?
And if you sincerely ask the question, well, then you better be prepared to wait for the answers. So that's more time. So what quickly began happening was my patient successes were just skyrocketing. My satisfaction of okay, now I know this is what I'm supposed to be doing. This is why I went through med school. This is why I came out and assumed all this debt and took these risks, is I'm getting people better. But now Blue Cross and United and Medicare or the hospital system, none of them care at all about outcomes, but they don't. So satisfaction was going up. Purpose was really climbing. But
so when you say satisfaction, you're talking about your personal satisfaction and your patient satisfaction.
Everybody. It was a win-win.
Everybody's happier.
Kind of pay cut after pay cut. But you can't think about truth is once you see it and you recognize it, I personally, you can't unknow it.
You can't unsee it.
You can't unknow it. And
so when you say pay cut after pay cut, so you were being paid based on a number of patients that you saw?
Oh, that's yeah.
So that's kind of how it works, is that you're paid based on number of appointments or number of units.
So there's the old system, which is the kind of ICD coding, which still plays a role. If somebody comes in with a wart, and you freeze a wart, right? So that's this lower complexity of deals. So you get paid this much for the actual diagnosis of the wart, and then you get paid pretty well for liquid nitrogen.
You get paid by the insurance company.
By the insurance company, or the person paying cash. So then you have the diabetic with cardiovascular disease and high blood pressure and kidney disease.
Right.
Plus their 3 complaints of the week. That's going to be a much higher complexity visit. So you get a little bit more on that. They're moving towards something called RVU, relative value units, which kind of takes into, but the main thing is volume. There are codes that you can put a modifier on to say, oh, I spent more than 15 or 20 minutes talking about this thing, but it does not.
Yeah, that's how, as a dietitian, that's how we bill, is by the amount of time that we spend with a person.
It doesn't really offset. And then things got worse for me in 2011, coming on 12, I believe. I can't remember. We decided to become hospital employed. My partner, Catherine, and I, became hospital employed. And that was around Obamacare was just coming in, and doctors across the country were nervous. What is this thing going to do? And what's going to happen to the way we do business and everything else? And doctors across the country pretty much sought refuge under these hospital systems, which we did as well. And it worked out for my partner. It did not work for me. But a part of it was self-induced too. I really thought like so naive of me, maybe / foolish, that they would see how healthy my patients were getting and like how few medicines. And so there was a honeymoon period of the pay was set, and then it really became sort of eat what you kill. And I mean, the first pay cut was like a 25%. And I really went and tried to plead with them. I'm like, but guys, I have the healthiest people out there. They're getting well. And it like dawned on me as it came out of my mouth, like, they're not going to be in the hospital that much. Like, oh, that was dumb.
That's the point.
Yeah. And so I had 3 years to do total. That realization really happened at the end of year 1. So I had 2 more years. Did it, exited as quickly as I could. And it was truly either go start a completely different career. Trees and lawn and landscape seriously was on my list of things to do. And I was able to find a model that patients would spend a membership, and that would open the door to really 2 main things. One, much, much longer office visits. You know, my annual office visit, I budget 2 hours for that first visit with a patient. Subsequent office visits, 45 minutes is my norm. Some people more like an hour, and it doesn't matter because their membership comes in and offsets that time component that insurance is not. But we also accept insurance as well. So it's kind of a hybrid model. It's not a true concierge, but it also opens the door to advanced lab testing that all of my patients for their annual, the toolbox that I now have available as of 2015 when I made this move, we're getting into like current decade lab technology, right? Not antiquated, really, really outdated lab tests, which the typical consumer of healthcare doesn't even realize. The fair market value of your annual whatever, I'm not picking on Blue Cross, but like that's the big carrier. I don't know the exact number, but my guess is it's like the fair market value is probably $12 to $15 of lab tests. Nobody, unless you're diabetic, you can't get your hemoglobin A1C tested, which is your 3-month average blood sugar. You can't just get a thyroid level. You can't get C-reactive protein, a marker of inflammation. You can't get the advanced lipid profile. So then if you're in that mainstream model as a doctor, well, now you have to start talking about a la carte, like almost like ordering off of a menu.
Right.
Well, now what just happened to your time constraint?
Right.
Like, so now you're trying to I have to know, what does the CRP cost? Well, it's whatever, it's $12. What's the advanced lipid profile cost? And then patients anyway, you can't really do it unless you get into either a concierge or a direct pay or something along those lines. And so I did that and became much like, now I'm not going broke. I can actually pay bills.
So your patients have an annual membership that they pay. And is there a monthly fee too?
No.
Just an annual membership, and they have access to you and all of the advanced things that you do as needed.
Right.
What does insurance cover at your clinic specifically?
What does insurance cover?
Mm-hmm.
So, so the annual visit is completely covered by their membership that they pay. The subsequent visits. So let's say on the first visit, we find a problem in their lipids or their A1C or like whatever. That'll set up a conversation in that initial visit. When they come back in whatever the time interval, 2 months, 3 months, once we have the diagnosis of impaired fasting glucose or elevated C-reactive protein or whatever, well, then insurance will pay, but they won't pay for the screening of it. But once you establish a diagnosis, they'll pay for certain things. So insurance will pay for those labs as much as possible. And then we accept whatever the insurance company pays for subsequent visits. So that could be, like I could be an hour in a room and might get reimbursed, $70, but it's okay with the way that the model is. But the reality is if I didn't have the membership, like that would pay for my 2 staff.
Right.
And I work for free. So, but the model works, and there's more and more coming about as the current system decays.
Yeah, I've seen a lot of cash-based physicians and people finally moving towards that, because do you think the financial problem is what keeps doctors specifically locked into that traditional model?
I think it's a lot of it. That's a big piece of it. That you can only, in primary care, right? So it's totally different in the surgical specialties, in the other specialties like oncology and whatnot. I don't think these same pressure points apply, but in primary care, so family medicine, internal medicine, pediatrics, it's volume. It's just volume. Quality and complexity play a role, and you can code for that, but everyone knows like you just have to run people through. And so the only way you can do that is to practice in the way that we're formally trained, which is, in my opinion, it's a reactionary, approach. It's not tuning into the human body's ability to heal itself and like what's in the way of the healing. And they don't tell us in med school, to be clear. Nobody stood up and said, the human body is not capable of healing itself. But it was like an omission. And so I'm of the mindset, an omission of truth it's a form of a lie. So I believe we were, in some level, lied to. Well, it rubbed me the wrong way in whatever year that was, 97, 98, but it's probably because I read the book Spontaneous Healing going into med school. Everybody else was just like, yeah, look at these. Because our knowledge of anatomy and physiology and pharmacology and pathology, I would say it's impressive. And I don't just mean LSU New Orleans, like across the country. We're really well educated in that. But that's what most people just know. So they're not even questioning, I don't think, like, is there something else out there? And then the reality of you got bills to pay, you very quickly learn there's pressure points. Mm-hmm. And, I waited tables all through college. I'm keenly aware of the amount of time people are waiting on me as a waiter. Like, as the wait time goes up, my tip typically goes down. Like, I'm Johnny on the spot, and I want to deliver a high level of service. That kind of followed me to medicine. And like, now we all have electronic health records. I can see people that are checked in who aren't even in a room yet. They're in the lobby, and that little ticker is just ticking along. And now, but I'm really trying to listen to this patient tell me their story, or I'm trying to educate, and it's like an impossible situation. So you have to play the game, or you go hungry.
I can imagine that when you come out of med school, I don't know how much med school cost exactly, but when you come out of med school and you have this enormous amount of debt, and hopefully you're very eager to help people. I mean, that's the reason you go into med school, because you want to help someone. But when you come out with such a tremendous amount of debt, and you see the path is kind of being fed to you, and you have bills to pay, major bills to pay now, that you just kind of go down that path, and until you take the blinders off and see that potentially there's another option, even when you can see it. I'm imagining, just kind of based on my experience and my practice, when you see it, to pivot and do something outside of the norm of what you've been led to believe all this time takes a tremendous amount of courage, a tremendous amount of strength. I would imagine there's a lot of fear in that, because especially if you have a family that's kind of relying on you, to pivot from what you have been taught to do and do something different takes a lot. That's a big step to take.
And I don't want to like deflect the like the compliment of it being courageous, but it didn't feel like courage. Like it just didn't. I was like, this is wrong. I know what it takes to get people well. And then like so many primary care docs, I was blessed and still am to be able to work side jobs, you know, and so when I was making this pivot, I was doing addiction treatment work and still am, but I could subsidize to an extent my major losses of revenue in the medical practice with working multiple treatment facilities and really felt some, like I was doing some good there too. And also was able to pay bills. But to go back to your question, like what is it that keeps us physicians stuck? Well, one is like the most obvious is the financial pressure. To answer your question, I came out of medical school in 2001 with a little over $170,000
of debt.
Of debt. My son, I don't even want to talk about that number.
Yeah,
I'm not paying it, but it. If I really thought about it, I'd lose sleep, and I worry about him. So anyway, that's a reality. And unless your parents were wealthy, mine were not. And I mean, I'm making a living, but I could not come anywhere close to keeping up with my son's med school tuition. Unless you read, like start being curious about like what else is even out there. Well, then you're, you know, the saying, if your only tool is a hammer, everything starts to look like a nail. Well, you just keep banging the same screw with a hammer. It doesn't work, but that's your tool. And so that you keep doing it. There's like risk of liability. All right. So when in one of my wildest cases, a completely out of control diabetic, that was in an inmate work release program. I would take care of the inmates for this program that was in New Iberia. So like 20 minutes south of where we were. The nurse called and talked to my nurse and said, could we get this guy in? His glucometer won't register. Okay, well, to me, that means, and to most people, that means your blood sugar's above 500. I said, sure. But before I get him in, let's do some labs. So I did his hemoglobin A1C, and it was 14.7, I believe. His fasting glucose was 574. And so sat him down, and he was just petrified because all of his ancestors, aunts, grandmother, mom, before they died of diabetes complications, their glucometers quit reading. And so
that breaks my heart.
Right.
It's so terrible.
And so this guy's uninsured, working as a welder to pay his room and board at the inmate program. I don't even know if he could read. So like me giving him this book was a non-starter. You can't do that. So I was like, all right, what's the landscape of food that you have available? And it was like Burger King. Okay. And things like that. And so I didn't use the word dirty keto. I'm like, we'll worry about heart disease later. We'll worry about all this stuff. Like you've got to get your blood sugar down. After about 45 minutes, and he was obviously highly motivated, he's thinking the Grim Reaper is like around the corner. And so because I knew I had a nurse at that facility, and I knew this guy was motivated with a fasting blood sugar of 574, I sent him home. Okay. If my insurance underwriter is listening to this, now this is long gone and the guy did well, they'd be like, oh my gosh, no, that's how you get sued. Okay. But I knew what was going to happen. And I told this guy, he was on 2 oral medications, cheap ones, like $5 a month meds. Neither of them really great. Neither of them super dangerous.
Obviously not working.
obviously not working. I told him, if you listen to me and if you do this the way I tell you to do it, you are probably going to have to stop this medicine, glyburide, or you're going to have low blood sugar. And the nurse ends up calling me. It wasn't even a month. And he hit like the 60s on his blood sugar. He came back in 2 months. His A1C went from 14.7 to like 6.4. And his fasting glucose was 88. Felt amazing, but to do it, like that would not have ended well in court had anything gone poorly.
Right.
When I don't smash statin drugs. Okay. I'm not anti. People think, well, like I probably am, but they misunderstand. I'm not. I'm just not going to over exaggerate their benefit, and I'm not going to diminish their side effect profile. When we are actively reversing cardiovascular disease, and I use a tool called carotid intima media thickness testing. So we're measuring plaque to the 1,000th of a millimeter. We're measuring the certain layer of the artery wall to the 1,000th of a millimeter. When I have a patient who comes in with all of the hallmarks, they've got chronic inflammation, their lipid particle sizes are not good, their A1C is high, they're just a metabolic disaster. We get that under control, and almost everyone wants to get off of their statin drug because many people don't feel good. And I can confidently tell them, and I sleep well at night, knowing, okay, your inflammation markers are now normalized, your blood sugar's regulating well, you've lost weight, you don't have sleep apnea anymore. Like, I just go on and on and on. I know what's going to happen to the disease process. Like, you're going to heal. So I tell patients, okay, now is the time. I think if you want to get off of Lipitor, and then we'll keep measuring all these markers, including your wall thickness and others, and they keep getting well. So I'm not worried about the liability part of it anymore, but doctors who haven't walked this walk. And so for me, like, this journey began, well, it really began with the Spontaneous Healing book, but I mean, like, really rubber hit the road, 2011. And now I just have so many repetitions behind me with patients and their successes. And some people don't. Like, it's not one solution for it works for everyone. But I just have the confidence now, and I know what works and I know what doesn't. And it's fun. And
the thing about working with people to try and get them to change is that change is hard. Mm-hmm. I mean, change is a hard thing to do for anyone, mm-hmm. and it takes time. You know, it takes time for them to understand why. You know, because nobody's going to do something just because you told them to. They have to see some kind of benefit to them in their story. But it takes time to understand the process, to implement the process, and trust the process. Mm-hmm. And then see, hopefully see some kind of outcome, which you always see some kind of outcome, whether it's the full picture of the outcome, like the outcome might be much larger. You might need to see more than what you see in that little simple progression, but it takes time. It is something that has to be done over and over and over. Right. So a 7 to 10 minute visit to tell someone you need to change is not enough to really even plant the seed that they have the tools that they need to be able to consider doing something different. Because for most people, all they see or all they know is what they do. So it's hard for them to even see that there's another possibility. Right.
And you said they have the tools to achieve those things, not you. Like, you're empowering them. Like, you can do this with these steps, and your confidence in their ability to do that versus I'm the doctor, here's the drug, listen to me, just giving people the empowerment that they need to make those decisions on their own. So let's fast forward a little bit to today. Mm-hmm. So you are fully out of the traditional model. You're doing mostly half a foot, out. Whole 1 foot out the door, and you're really seeing your patients healing. You want to talk to us about what board certification is a little bit?
Fun conversation. So board certification it's something most physicians don't even like question. Like you just get board certified and you maintain board certification. Okay.
And that's for a specific specialty, right?
Yes, it's absolutely. Okay. So across all specialties, you acquire it, you take a not fun test, you send money on a regular basis. You have to maintain continuing medical education. And then it used to be 7 years. Then they pushed it out to like 10 years. You take the not fun test again. And if you pass it, you maintain your board certification and you get another plaque to put on your wall. Hospital systems use it heavily. It's a pressure point. For you to get credentialed with the hospital, you have to have that piece of paper. You have to have the board certification. Used to be insurance companies. I don't think they really care that much anymore. But the addiction treatment centers that I used to work with, when I still had my board certifications, they needed a doctor with that piece of paper. To me, I never really saw the value in it, except that it allowed me to sort of play the game. I never felt like being board certified made me a better physician, smarter, more up to date on anything.
So it kind of sounds like it makes sure that being board certified makes sure that you stay within the guidelines that they've given you.
Yeah, don't color outside the lines.
Yeah.
You stay in the sandbox. I personally could never or rarely answer a board question the way that I would do the practice in real life. Like, right. I had to think like the author of the question, and I got good at it. I know doctors, I don't call anybody out, but I know like it's a common thing. Like we figure out like what angle is this question coming from, and we answer the question that way. I was board certified in family medicine and addiction medicine, and never really questioned it, never enjoyed it, didn't enjoy the money part, although the money's not terrible, keeping the certification up, answering the questions and doing the CME that none of it was like functional. None of it was about nutrition. Or if there was a nutrition question, I had to answer it completely the opposite of the way that I would do it in real life. So the COVID era, let's call it, popped up, and I mean that could be its own podcast, but
probably will be.
The short of it was, for me, like I just saw signs early on that a lot of what was being pushed was not founded in science. Everything from the effectiveness of the paper mask or the cloth mask to the distancing to the herd immunity won't work with COVID. And they were saying herd immunity won't work with COVID like in March of 2020.
Yeah.
Like if indeed herd immunity wasn't going to work, you wouldn't know it ahead of time.
Right.
You would learn it in hindsight. You would say, wow, people didn't like get immune. And anyway, so I was not swallowing the pill, not drinking the Kool-Aid, but didn't have all the answers for sure. I was really working on, with my social media posts and in real life, like, let's just sort of take more of an offensive posture with this condition. Let's work on getting healthy, optimizing your immune system, which is everything from eating properly, working on gut health, getting sunlight, exercise. If you have weight to lose weight.
I would say that was my biggest frustration, amongst many frustrations, but we had a very captive audience at that point because everybody was scared. There was an audience to say, what you do in this moment matters.
Yeah.
Right.
What you put in your mouth matters. What you, the sunlight that you get matters. And it was not said at all.
Right.
No one said anything.
People were afraid
or very
to
few
say.
people said anything.
Right.
It was such a disappointment, and another obvious reason that I could see that our the people who we have given the powers to look over us are not at all looking over us.
Mm-hmm. Right. And then it's just the various decrees kept coming down, whether it was about ivermectin or hydroxychloroquine or you name it. It was like, it was an effort to cast doubt on anything simple, anything affordable, or any component of the human body that might lead to you doing well as opposed to doing poorly. So my antennas just kept perking up and up and up. And I started having successes with treatments that were being trashed on the national media. I was really, still am, but really blessed to have a staff that was not scared. And so the other doctors in our clinic who were hospital employees, if someone came in with a symptom anywhere close to COVID, it's like put on the hazmat suit and they'd go meet the patient in the parking lot. And, the nurse would get a swab from like ways out and then do it and then go back and give them the result. Like we were letting these patients come in and sit with us. We would test once the tests were available. I'd walk in a room and for the majority of it, I had never caught the first case of COVID, but my mindset was, well, I'm probably going to get it and maybe I need to get it. And when it happens, it happens. And that's going to be an inconvenience, but I'm going to be fine. We're getting people well. I was able to, with several patients who were like really going down the tubes, we're talking to them over the phone and they're dreading going to the hospital as I would. Like it was really, really sad, maybe even evil. A lot of what was happening in hospitals, people just being stuck in a room. And I mean, I have a patient who was in just another state. I'm not going to single it out, but we're talking on a regular basis and he was not doing well. Okay. And he gets put in a room and the respiratory therapist came in like this serious hazmat suit, put the supplies to do nebulized treatments on his bed, told him real quick how to do it. And he jetted. He got out of there. And so this particular patient already sort of an anxious type. And I mean, so his fear factor was off the chart. We talked multiple times that week. He ended up doing well, avoided the ventilator. But it was just a mess. And so I posted a lot, had a few posts before the AI, the algorithm of Facebook figured out me and maybe people like me. And a few of these posts just really went crazy.
This is your personal Facebook page.
Right. Okay. Right. And I think some of them would go, I just don't do a lot of social media, or I wasn't at that point. So I didn't have really a professional MD page. So it was just my personal was what all this went on. And one in particular went nuts, viral within like 3 hours, like almost 500 people had shared it. I'm getting hate from one particular local physician and her little pack of minions, I would call them. And, but the majority was like overwhelming positive. And that's what the people who were sharing it were like, wanted this, what they saw and what I saw as truth to get out. That one earned me a call from a state public health official that afternoon. She was actually, to her credit, very, very nice and very civil, but wanted to know, like, basically, could I like stop?
What was the post?
So, March 13th was a lockdown.
The day my daughter was born.
All right.
That's my son's birthday also.
And
March
I remember
2020.
Our favorite restaurant at the time was about an hour away in Baton Rouge. And it was the day before my birthday, March 14th. And I'm normally the driver, not because of a control thing. I just I like driving, and Kasia doesn't particularly care. So I'm always driving. We got in the car and I said, baby, could you drive? Take us to Baton Rouge. And I brought my tablet, my little iPad, and on the Basin Bridge to dinner. And I mean, there was really a lot of anxiety, not a ton in me, but it was palpable. And we just didn't know the uncertainty of like, where's this all going to end up? So this first post was basically just to tell people like a coronavirus is not the boogeyman. Like we were taught about this in med school, in the auditorium on Perdido Street, like in whatever, 1998. It's in the family of the common cold. And just an education and about like mutation. That was a buzzword that the journalists were like, oh, it's mutating. It's mutating. Like, well, that sounds scary. A mutant. Like, well, this is what viruses do. This is why there's like a new flu strain or multiple ones every single year. So it was a informational only. Here's what a coronavirus is. Here's what mutation's all about. It's not scary. It just happens.
Sounds very sci-fi.
Yeah. And then I talked about zinc and vitamin C and vitamin D and sunlight and gut health. Now that post didn't go crazy. That one didn't go nuts. That was just like me warming up. But people received it well. They did share it a fair bit. I didn't get any hate about that one. But the one that went crazy was mid-May of that same year. So just 2 months later. And what triggered it was, if you remember in the first month and a half of the COVID pandemic, there was like a death counter on the bottom corner of some of these screens. And it was new deaths. And it was just part of like a stock ticker, you know? And then I noticed in May, it seemed like they quit talking about new deaths. The death ticker got replaced with a new case ticker. And you had de Blasio, and you had Fauci, and you had the Biden administration. Not at that point. No, it was just Fauci. But they were like, we need more tests. We need more tests. This is the way out of this pandemic, is more tests. And then we were doing tests at the local college football field, and you would get a voucher for a free chicken tender fry meal or like a McDonald's Happy Meal just for going to get tested. Places were giving out a donut if you went and got your test, and you didn't even have to have symptoms. They just wanted tests. So it dawned on me like, okay, so probably they're not talking about deaths anymore because the deaths are drastically declining, and they're talking about new cases because that's important to keep the narrative going. So I went to the CDC's website and I looked and I found 2, and they pulled these down not long after. I'm not saying I'm the one, but these disappeared. But it was the stratified by age, the death numbers from March until May. And what it clearly showed was, there was a spike, and it was the nursing home population, really chronically ill, fragile, frail. And as the age cohorts, got younger and younger, I mean, the numbers were just really not impressive. But there was this spike, and it was like on its way down to like baseline pre-pandemic. And so, I would quit talking about it too if I wanted the hysteria to continue. Well, then I pulled up some data on new cases. And anyway, so that was the post. I was just frustrated and maybe even angry when I made the post of like, it just seemed like there was deception going on, and they were manipulating data to an extent and not telling us the truth. Well, that one went nuts. And I mean, I had friends calling me. Not many physicians took to the platform to support me with the really negative, nasty stuff that was coming my way. a lot of texts and phone calls and even a few personal visits of people, but nobody wanted to put their neck out, which is fine. I guess I get it. That's not even the one that got me in trouble. That's the post that got me on the radar. Joe Rogan interviewed Robert Malone, and I listened to that 3 hour. All the Joe Rogan stuff is 3 hours. It's kind of like when I read The Paleo Solution. Like I'm looking for like a hole to poke, and all of the science sounded really, really credible. And so I believe the post that resulted in both board certifications tumbling was I posted a link to the post and I said something to the effect of serious truth. Y'all need to listen. And that was it. And so then I got the letter from, one, and I just couldn't comply.
What did they want you? What were they asking?
They basically wanted me to do a very, very thorough citation of everything that I had ever said with respect to COVID. What scientific source did it come from? So basically like a thesis, and stand up publicly on the social media platform and maybe in other ways and renounce everything and tell people, sorry, I was wrong. The vaccines are effective. They are safe. They're all of these things. And I just couldn't do it. I wouldn't do it. So I let that one go. And then that, without family medicine board certification, I couldn't have the addiction board certification because there were different pathways at the time to become addiction medicine board certified. And it was sort of a grandfathering that they allowed my era to do. So I had to have the primary to be addiction board certified. So both of those fell. And that was, it was somewhat stressful, but.
So when you don't have board certification, obviously you're still capable of practicing medicine.
Mm-hmm.
So you're just not following, right. It's saying that you are not necessarily staying in the lane that they have given you.
Right. So, I still have a license to practice medicine in the state of Louisiana. If for some crazy reason I wanted hospital privileges, like to go start seeing patients and rounding on them, they probably would not grant me those privileges. But I actually can't get them anyway because most hospitals, if you don't admit at least 20 patients a year, they deem you like you don't have enough volume to remain competent. And it might be true, So I couldn't get it anyway. So it doesn't affect me at all. And it's just it's kind of been liberating a little bit. Like and my patients know me well enough now. I didn't do it to have some badge of courage, but they're all proud. I don't even advertise it. Like this might be the biggest word of that ever gets out. But if the conversation comes up, I'm also not ashamed. And they're like, good for you, Okay.
Well, it's nice to have somebody who's going to stand up for what they believe in, be honest with their patients, and just not be afraid of the boogeyman, really. Yeah. It hasn't affected you.
Definitely not affected me negatively. And I think I probably sleep better at night.
Mm-hmm. What keeps you inspired and motivated even in the face of setbacks?
It's mostly patient success stories. I definitely wouldn't want you to believe, or the audience to believe, that like I'm anywhere close to batting 1,000, but it doesn't take many. It takes the patient with severe autoimmune disease that can turn it off and go into remission. Those are probably some of the most rewarding. Just seeing people get well, seeing people thrive.
I think when you can give somebody hope that their life is going to be something other than what they have been, the picture that has been painted for them, that is a tremendous, that's a good feeling to know that you're giving someone hope that they can be more than what they've been told they can be.
Thrive, and not just survive.
Introduce them to truth. Just shine light on truth and inspire them and coach them and guide them. There's a patient that she does not want public attention. you guys have to interview. This is a different conversation, but just a crazy autoimmune story where life circumstances, they went from being wealthy to selling their forever home and hoping to avoid bankruptcy. And it was actually, ironically, it was COVID, okay, affected the oil field really adversely. And she was managing, not thriving, but managing an autoimmune. But it was, $6,500 a month medication, which essentially was handcuffing her immune system, not allowing her immune system to attack her joints and her uvea, part of her eye. Massive financial downturn, can't afford health insurance anymore. Like, it was that bad. If you can't afford insurance, you sure can't afford the $7,000 a month medicine. And so very quickly, her autoimmune laid her up in bed. And a good day was if she could get out of bed. And like, she's my age, okay, 52, 53. And we had talked before when they had wealth, when they had means. Complicated. She wanted to do it. Family was not really on board. Well, now it's like do or die. And she's amazing, just vibrant now. People are asking her like, what plastic surgery, what injections? I was like, it's none of that. And then she's actually tired of hearing the questions now, because people saw her for so long, never knew how sick she was. They're like, she's looking like radiant. And they're like, what do you do? Well, I don't eat grain anymore. I don't eat seed oils anymore. I don't drink alcohol. And then people can't get away from the conversation quick enough.
Yeah.
They're like,
well,
oh,
I know
no,
that.
no,
Oh, wait,
no.
so that's something that I have to do? I have to change?
Right.
I can't just rely on XYZ?
So stories like that, that goes a long way. It's just so rewarding. And they're not all, they don't have to be all that profound, but I have several like that. That would for sure be what keeps me going. The other part is I can't unknow what I know. And so I'm just stubborn and hard-headed. And even when it's not going well, or there's a setback or whatever's next, I'm like, just gonna be a pain in somebody's butt and keep doing what I do.
It's your calling.
Yeah.
Don't really have much of a choice.
One of them.
Where do you see your practice evolving in the next 5 to 10 years?
Next 5 to 10 years. Really interesting. Who knows where technology is going to be with AI, with, all sorts of other things, stem cells, exosome therapies. I suspect that within a very short period of time, 2 years, 3 years maybe, like our knowledge of the human gut microbiome, that's something you're really interested in, and you as well. I still think we're like tip of the iceberg.
Oh yeah, we've just barely scratched the surface.
Yeah. So as that frontier gets, sort of conquered, I would imagine you'll be able to give a stool sample, and within a very short period of time, analyze your microbiome, tell you what diseases you're at risk for based on your microbiome, create a probiotic that could be pills, could be an enema, could be something, and you get a prescribed regimen that's unique to you at this point in time, which is
personalized medicine.
Yeah. Western medicine is a really, really defensive, reactive approach to disease. And I call it over and over like what it is. It's a disease care system. It's not a healthcare system. I'm more interested in like an offensive approach to disease. Like, that's not just like try to raise our shield up and whatever. Like, let's go at it. And so a lot of what we're doing with Wellspring, which is, it's a lot. Like, so there's, it's strength work done efficiently, quickly, cardiovascular training done very efficiently, much quicker than I ever thought it could be done. Sauna, cold exposure, red light therapy, hyperbaric oxygen, pulse electromagnetic frequency, ozone, all these different modalities, all designed to flip switches, like turn levers in the human body and just optimize where disease, like you change the terrain, you change the soil of you to where disease like has a really difficult time rooting in. And I want to go more into that and blur the line. Like when is Ed in physician mode, or when is he in coach mode or educator mode? Like I want people like, what hat is he wearing right now?
All of them at once.
Maybe. Yeah. But less, not to pick on like stethoscope, but like less time with the stethoscope, more time really empowering people, and teaching them, and then creating a community where I don't want anybody dependent on me. Anybody. I don't want my kids dependent on me, assuming like when they're little, they are. But my job is like, I don't want you to need me. I want you to want to hang out with me, if it's my children. But same thing with my patients. Like if I do my job right, you learn what you need to learn. Like, and there's not a whole lot of need to do this concierge hybrid model with me. Like go, I want the relationships. I'd love to keep working with people, and I need some component of that. But to me, and it'll never happen, especially in South Louisiana, like our food culture is, I think it's got to be about as bad as any place in the country.
I think we run a close race with Mississippi.
Right. Yeah. We're always racing to the bottom.
Yeah.
So I'll never get Acadiana well to the point of like, oh, okay, I'll go start that lawn service. But it would be fine. It would be totally fine if I did that.
Well, we're working on it.
Yeah.
Health revolution. So we have one last question.
Yep.
What does living vividly mean to you?
Living vividly. It's a lot of things. It's being free of disease. I mean, maybe that's the most obvious, the way I picture it. Like, because you can't, if you're burdened by chronic illness, whether it's you just hurt all over, or you have no energy, or your brain is diseased, you're not going to thrive. You can't. It's like treading water with, whatever, like dumbbells in your pockets. Having energy, having purpose in your life, having not just abundant relationships, but high quality relationships, having a spiritual practice that, but I guess it all just comes back to purpose, and being able to, I don't know, live out the design that I think we were designed for. We're not designed to be sick, not designed to be tired and obese and diabetic and cancer ridden. Part of it is, this is one of my struggles, is maintaining like gratitude is a big piece of that. Because I'm always like, I can very easily stay in all of the things that I don't have.
Right.
I mean, I think it's kind of natural, but
I think that's part of human nature.
It's a good answer.
Yeah.
Multidimensional.
Yeah.
Well, thank you so much for spending an hour and a half with us. It's a great conversation. I'm sure we have so many things that we didn't even touch on. So hopefully you'll be back.
I'll be happy to.
Repeat.
We'll have to dig a little bit deeper on some more like medical things.
I'm an open book.
Absolutely. Seed oils.
Oh,
That's a fun one.
Good stuff.